Hello, friends. Today's topic is on coronavirus disease and pregnancy, breastfeeding, and complementary feeding. At the outset, I would like to thank BPNI Maharashtra for giving us a chance to speak on this important topic, which is very relevant in our corona pandemic. I, Dr. Sushma Malik, Professor and Head of Department of Pediatrics and Neonatology Division at TN Medical College and BYL Nair Hospital, Mumbai, will be speaking on breastfeeding, and my colleague Dr. Jayan Shah will speak on complementary feeding. I also take this opportunity to thank Deepti Shah and Dr. Prashant Gangal for their valuable contribution in this presentation. Measures for pregnant women to prevent COVID 19 infection is similar to that of the general population. The coronavirus spreads by droplets from the infected person while talking or during the act of sneezing and coughing, and these droplets can reach up to 1 meter or settle on the surfaces. Therefore, respiratory hygiene is a very important precaution. The mothers should use a face mask that covers the mouth and the nose. During coughing or sneezing, the mother can use her bent elbow, a handkerchief, or a tissue. These used tissues should be disposed immediately, and this is a very important component of respiratory hygiene. She should avoid touching the eyes, nose, and the mouth with her hands. She must follow social distancing and maintain a distance of at least 1 meter with the next person. She must avoid gatherings, functions, and crowded places. Hand hygiene is another important precaution that has to be followed by everyone. She needs to wash her hands frequently and properly with soap and water or use an alcohol based rub for a minimum of 20 seconds. She must also avoid or have a decreased contact with people who are sick. Pregnant mothers do not appear more likely to contract the infection than the general population. And as of now, there isn't enough evidence that pregnant mothers are at higher risk of severe illness unless they have associated comorbidities. Currently, no data suggests an increased risk of miscarriage or early pregnancy loss or any teratogenic effect of the virus. Generally, the clinical presentation of COVID 19 infection in pregnant mothers in majority of the times is mild. Mothers, in case they have respiratory infection or symptoms, they must report to the doctor and follow strictly the respiratory and hand hygiene, which has already been enumerated in my previous slide. With regards to vertical transmission, that is, transmission from mother to baby antenatally or intrapartum, there isn't enough evidence or studies to prove it. At present, there are no cases of virus being detected in the amniotic fluid, vaginal secretions, in the breast milk, and other fluid. The main risk for the baby to catch the virus infection is from close contacts with either the mother or another infected member of the family. If anyone is sick in the household, take care to protect the baby by practicing wearing a mask during feeding. Mother should wash hands with soap before and after touching the baby and wipe and disinfect surfaces regularly. Should every pregnant mother be tested for the COVID 19? Well, this is a dilemma as protocols and eligibility for testing have been changing over the time in the last few months. Current testing strategies for pregnant women by the ICMR and the Ministry of Family and Health Welfare are testing to be done for all symptomatic mothers as well as pregnant women residing in clusters or containment areas or in large migration gatherings and evacuees center from hotspot districts presenting in labor or likely to deliver in the next 5 days even if asymptomatic. The test method is usually with an RT-PCR test from the nasopharyngeal swab, which is used for the diagnosis. Breastfeeding recommendations for mothers who get COVID infection or for non COVID infections is the same. Breastfeeding is the cornerstone for infant and young child survival, nutrition, development, and maternal health. WHO and UNICEF have advised early and exclusive breastfeeding for COVID 19 suspect and confirmed mothers while encouraging them to take advocate precautions. For newborns, initiate breastfeeding within first hour after delivery and practice skin to skin care as soon as possible. Also, support the mothers for exclusive breastfeeding for the next 6 months. Mothers who get coronavirus infection shortly before giving birth or become infected while breastfeeding will produce immune factors or antibodies in their milk to protect their baby and enhance the baby's own immune responses. This means that continuing to breastfeed is the best way to fight the virus and protect the baby. If a breastfeeding mother has symptoms of COVID 19, which in a majority are mild to moderate flu like symptoms of cough, sore throat, fever, and very few of them may have difficulty in breathing or shortness of breath, she must seek medical advice at the earliest. The mother should follow instructions both for respiratory and hand hygiene and practice social distancing. The mother must wear a medical mask, preferably, or she may use cloth mask while breastfeeding to reduce the possibility of spread of COVID-19 virus infection to her infant. The mask should be replaced if it becomes moist and she should dispose it immediately. She should not reuse this mask. The mother should also not touch the front of the mask, but she may untie the mask and carefully remove it. If the mother sneezes or has cough, she must sneeze into the tissue and immediately dispose it and use either alcohol based hand rub or wash her hands again for at least 20 seconds with soap and water. Washing hands frequently, especially before and after touching the baby or feeding the baby, is very essential to reduce infection. Routinely cleaning and disinfecting any surfaces that the mother or the caretaker may have touched by cleaning either with soap and water or with alcohol based sanitizer will reduce the spread of coronavirus infection to the baby. If a mother is too ill to breastfeed, she should seek immediate medical advice. We need to support her for breastfeeding and for continued lactation in all possible ways. She can express breast milk if possible and ask a non infected member of the family to feed the baby using all precautions. If the mother is unable to express breast milk and milk is available from a human milk bank, then donor pasteurized human milk can be fed to the baby while the mother is recovering. We also need to support her after she recovers from her illness for relactation purposes. Expressing breast milk is important to sustain milk production so that the mothers can breastfeed when they recover. Expression of breast milk is primarily done either by hand expression or with the use of a dedicated mechanical pump. Hand expression and using a pump can be equally effective. The choice of how to express will depend on the maternal preference, the availability and cost of the equipment. The mother or any non infected member of the family should wash their hands before expressing breast milk or touching any pump or its parts, and ensure proper cleaning after each use. The pump, the milk storage containers, and the feeding utensils need to be appropriately cleaned after every use with liquid soap and warm water. The express breast milk should be fed to the child, preferably using a clean cup and or spoon or with a paladi or a bondla. Also remember that it has to be fed by a person who has no signs and symptoms of the illness and with whom the baby feels very comfortable. Now I hand over to Dr. Jayant Shah, who will complete the second part of the presentation. Thank you.
I am Dr. Jayant Shah, pediatrician and international board certified lactation consultant and past president BPNI Maharashtra. The question arises whether the mother with COVID-19 illness can hold her baby. Yes, certainly, if she wants to. Like any other normal baby, early and prolonged skin to skin contact is recommended. She should exclusively breastfeed her baby up to the end of first 6 months like any other mother baby pair. Mother and the baby should stay in the same room, which is called rooming in. There have been doubts in the minds of some individuals about this, but now it is clearly recommended that having the mother and the baby together has great benefits even in the COVID situation, and there are no extra risks. However, the mother should take the usual COVID related precautions. The mother should take all these precautions throughout the 24 hours, day and night. Proper hand washing has to be practiced regularly. If the mother has no respiratory symptoms like cold and cough and she is inside her house with the baby, she need not use the mask as it will prevent the kissing of the baby and proper skin to skin contact. However, if she is outside the house or if there is any respiratory symptom, she must wear a mask and practice respiratory hygiene. However, masks should not be applied to the baby. Babies under 2 years of age should not be wearing any mask as it may cause some obstruction to their breathing. What is the responsibility of the health facility staff? Whether or not the mother or the baby has suspected, probable, or confirmed COVID-19 illness, the healthcare worker must ensure the usual infant and young child feeding recommendations along with the hygiene precautions mentioned earlier. They should also provide the counseling, help, and support for breastfeeding both before and after delivery. And the important point is that they should not promote any breast milk substitutes, feeding bottles, teats, pacifiers, or dummies. There may be some recommendations from the non standard organizations to separate the baby from the mother or not to give breastfeeding if the mother is COVID positive. Actually, the mother and the baby must be together and breastfeeding has to be promoted. The healthcare worker must be aware of the wrong recommendations and must clarify this as there may be doubts in the minds of mother and other members of the family. While counseling, both antenatally and postnatally, a special mention has to be made of the feeding during COVID situation. Next few slides are about the complementary feeding. The details of this are given in another video on infant and young child feeding. Even in the COVID situation, all the usual recommendations for complementary feeds are to be followed. In the COVID scenario also, the baby should continue to be breastfed up to at least the second birthday, and solid complementary foods should be started when the baby completes 6 months. The care and precaution about COVID must be continued. Ideal complementary foods with good quality, quantity and diversity becomes even more necessary in COVID situation to improve the baby's immunity. If the baby does not receive all the food components, there may be deficiency of protein, vitamins and micronutrients, and the baby will become more susceptible to infections, COVID or others. The food items brought from outside like vegetables etc. must be properly washed before using. For the person who goes out to get the material for complementary foods, use of mask and maintaining proper physical distancing is important to avoid contracting the COVID infection. Hand washing thoroughly for 20 seconds should be practiced. As stated earlier, if the baby and the mother are inside the house and the mother has no cough or cold, she need not wear a mask while feeding her baby. But if they are outside the house or the mother has cough or cold, she must wear a mask, but the baby should not be wearing a mask as mentioned earlier. The complementary foods are started at the end of 6 months and breastfeeding is continued. Hand washing is essential. As the baby grows and gets used to the solid foods, gradually increase the frequency of feeding and quantity of the food. However, the food should never be forced. It is the baby who will decide how much food is to be eaten. Gentle coaxing is okay, but not forcing. Optimal complementary feeding depends not only on what is being fed, but also on how, when, where, and by whom a child is fed. This is called responsive feeding. Along with this, the texture of the food should also change from fully mashed food to less mashed and more granular as the baby can tolerate. That is, the density of the food should gradually be increased. At around 8 to 9 months, the baby can hold finger foods and this should be encouraged, taking care that there is no risk of choking. The feeding must be continually supervised. The speed of this change varies from baby to baby and one should watch how quickly or slowly the baby is adapting to the changes. This change of texture is important for the good development of the baby's oral cavity. A rough guide for frequency of feeding is from 6 to 9 months, at least 2 to 3 times a day, and if the baby accepts, another one, but it should not be too much, otherwise it will displace the breast milk. From 9 to 12 months, 3 to 4 meals plus 1 to 2 snacks if accepted by the baby. From 12 to 24 months, the frequency of feeds will remain the same, but the quantity of food per feed should increase. That is 3 to 4 or more meals plus 1 to 2 snacks with more quantity. World Health Organization has described 7 food groups. Of these, at least 4 food groups should be given every day. Adequate frequency and variety of foods together decide the adequacy of diet. It is important to avoid all junk food as it will reduce the consumption of good food, give false calories, and there is a risk of environmental toxins being introduced to the baby via the preservatives. It will reduce the resistance of the baby. During this period also, the breast milk continues to supply higher quality nutrients than complementary foods and also protective factors. It is therefore recommended that breastfeeding on demand continues with adequate complementary feeding up to 2 years or beyond. The immunity of the baby is especially more important in this COVID situation. It is very important to frequently wash the hands thoroughly for 20 seconds as explained earlier to prevent the spread of COVID, especially before feeding and after defecation. This will also prevent the waterborne infections like typhoid, jaundice, cholera, and also worm infestations. Good nutrition is important for the baby, especially in the first 2 years of life. It helps in proper growth of the baby and development of good immunity. This leads to better cognitive development, that is, the child's brain and IQ develops better, and there are less chances of child becoming ill. Even if there is any illness, including COVID, it will be milder and the child will recover faster. It means that the chances of acquiring infections are less, and also if infected, the severity will be less. It will also lead to lesser chances of developing chronic illnesses. Give the baby the best possible start to life. A variety of foods is essential to give all the required nutrients to the baby. Dark green leafy vegetables will provide vitamins and fiber and iron. Orange or yellow colored fruits and vegetables are rich in vitamin A. Grains like rice, wheat, etc., and legumes or dals will provide carbohydrates and protein to the child. It is important that the baby consumes adequate water through the day so that the baby's urine output is maintained. Breast milk also provides good amount of water. This will also depend on the season. More water is required in hot weather. Avoid giving excessive salt, sugar, or too much of fat. Hence, it is important to stay away from junk foods which have high sugar and high salt content and also trans fats. The most important way to avoid COVID-19 infection is to avoid exposure to the infected individuals. The Government of India's Arogya Setu app is also useful and we should use it. Remaining indoors is vital. Stay home, stay safe.